You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J Tassoni Jr., with today's guest.
Welcome to Recovery TV. I'm your host, John Tassoni. This is the voice of hope. Today my guest is Amy McCarthy, who is a LICSW and the SOAR Clinical Coordinator of Emergency Services for Gateway. That is a mouthful, Amy.
Yes,
and welcome and thank you for joining us today.
Thank you for having me.
So tell me what Gateway is doing with the overdose issues in the state of Rhode Island.
So Gateway Healthcare is a community mental health center. We've been around for over 30 years. And recently what we've been doing with the overdose epidemic is really making sure our staff is trained and knowing how to facilitate Narcan. We have Narcan located at all our facilities, including our group homes, and really just educating the community as much as possible about the epidemic.
Staff. Shortage? Overburdened? Tell me about it, because we're getting a number of calls here.
Right. So just like every other healthcare facility in the state, yes, we are short, but our staff members are amazing and doing as much as they can for our population and our community.
So we work together in the town of Smithfield on a couple of initiatives. One of the initiatives is that your organization works with the police and fire when they have overdose or mental health issue. Tell me about that, and tell me how you see you as a provider working with other cities and towns to do the same thing we're doing in Smithfield, because I think all 39 cities and towns could use your services.
Well, thank you. So, yeah, what we do in Smithfield, as well as North Providence and Westerly, is we do have a clinician embedded with the police department. So that way, if they get an overdose call or if they get a mental health well-being check, our clinician can be one of the providers on the scene. What's really nice about that is when we do that, the police secure the scene, make sure that we're safe, our patients are safe, and then they let us take the role to try and get the person the help that they need. We are currently working with Pawtucket on a similar initiative, but North Providence, Smithfield, and Westerly, we've been there for over a year for each of those places.
Was the acceptance a little pushback when you first went in, or did they accept you? Sure, come on in.
No one likes change, right?
Exactly.
So
That's why I'm asking the question.
So administratively, yes, we were welcomed with open arms, but the boots on the ground officers just had a little bit of letting us into their brotherhood, into their kinship, and it's been working really well. Especially with Mary Kate McCarthy. She's been with us since the inception of this. She's really been instrumental in getting that partnership together with the police departments.
So tell my viewers how it works.
So if someone were to call the police department and want a well-being check on a family member, maybe they're acting bizarrely a little bit different, maybe they have been using some substances, the police have access to us 24/7 and they can contact us and say, hey, can you come out on this call with us? Or maybe they've gone out on a call and they've gone a couple of times and they know it's a mental health issue. They can also contact our agency, our clinicians who are there on site to say, can you come out and follow up with us and see if there's anything we can do to help this person?
When you follow up with the individual with substance use disorder or mental health, you go right back to their house within a few days, correct?
We either do phone
To
call
follow
or
up.
we either do phone call or if they allow us to come out to the house, because we're still very aware that we are in a pandemic and we don't want to push ourselves on anybody. We can do either or. We can do phone call or we can go out to the home. We can do social distancing. We can do our assessments outside, whatever the patient's most comfortable with.
So on the flip side of this, I know the police were a little bit standoffish in the beginning in fire. Now,
Your words, not mine.
that's my words, because I've been there. What about the other side? What about the patients? What about the people that you service? Are they more acceptance when this happens?
Well, you have to remember when we're going out there in crisis.
Right.
So they may not be accepting right away. It might take a little bit of time for them to get used to having a clinician come on scene. What I have noticed is family members are very, very receptive. They don't want to call the police on their family member. They don't want to call the police on their friends. But they do want them to get help. So knowing that a social worker, a clinician, someone who's trained in de-escalation techniques for mental health providers is really been helpful for at least the family members. And eventually we've had a lot of people who we've gone out and seen on crisis, and then we've gotten them into services. So it's been helpful for them as well.
I know from my work here that when you get out into the community, the acceptance of family is a lot more than the acceptance of a client. When you revisit the client and try to help them through their crisis, is that a seamless transition for you guys? Or is it sometimes there's a lot of pushback? I mean, you know, in this industry that we work in, some people may want help and some people may not want help.
Mm-hmm.
Most of the time, they think they can do it themselves without the help.
Mm-hmm.
But we know what happens if they turn us away. You know, I was looking at some statistics the other day from just my town, Smithfield, and I was flabbergasted by those statistics about the amount of overdoses and the amount of calls and mental health issues. But it's not only Smithfield, this is a statewide issue. This is not going away anytime soon. Children, I believe, and I'm not a clinician, it's going to be a long effect on our youth, a long effect. As we see it, I mean, I got a text message today that there's another variant coming in, and it should hit Rhode Island in 3, 4, 5, 6 weeks. So we're always going to have to be in the forefront of substance use and mental health issues from here on in.
Mm-hmm.
You know, and it's too bad something like this had to happen in order to get your folks, along with a lot of other folks, finally thinking of mental health issues and substance abuse issues. We are definitely going to break another record this year, in my estimation,
Unfortunately.
of overdoses. The amount of calls the fire departments are getting, and you know, you see it all the time. But how does an organization like Gateway try to wrap their arms around something that is so huge, and it's like a train going down the tracks, and there's no one that can stop it? I mean, obviously the clinicians are key, management is a key, the hospitals are a key. How do we do it?
So I do have to say that our clinicians, they're very robust. So Gateway responds to multiple emergency rooms on top of doing community crisis assessments, on top of doing case management and all of the other services that we offer. So I will say that our clinicians are doing the best that they can. We're helping out as much as we can. To answer your first question about the seamless transition, it's never seamless. We get somebody, we get them to the hospital, they get out, they don't want services, we just let them know that we're there. If we go out again, they already know us, they know it's going to happen. Mm-hmm. So we just continuously try to let them know that we're there when they're ready. Sometimes they can get court-ordered to treatment. That does help it a little bit, but that's not everybody qualifies for that, and we're not going to take everybody's rights away because they don't want treatment.
Right.
I think it's just a matter of letting the community and those patients know that we're not going anywhere. Regardless of a pandemic, we worked throughout the whole thing. We showed up to work every day. We still went out and we did our crisis work. Our case managers still contacted their clients. We still did our medication drops. What our community needs, we're there for. And we just keep on keeping on. That's all we can do.
You're watching Recovery TV, and I'm your host, John Tassoni. We're here with Amy McCarthy and Gateway. We'll be right back after this.
You know, every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated-assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated-assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. Kodak Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through Kodak's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call Kodak.
Welcome back to Recovery TV. I'm your host, John Tassoni. Miss Amy McCarthy is here, and she's my guest. She's with the Gateway Healthcare Organization, and she's a SOAR Clinician Coordinator of Emergency Services. Big mouthful, but a little lady. Amy, welcome. Thank you for joining us today.
Thank
I
you
want
for
to talk a
having
little
me.
bit about, we were talking about emergency rooms. You know, the stories that are coming here are horrifying about the amount of time in the emergency rooms and not having enough staff, and everybody's using the emergency room for their doctor visit. What are you hearing in the community as far as people visiting the emergency rooms? You know, we talked, my prior individual was sitting in your chair, talked about the length of time it takes to get to the emergency room, the length of time to see a doctor. That portion of the healthcare is significantly compromised right now. What are you seeing out there?
So the goal of my particular program is to avoid the emergency room if possible, and also to kind of streamline it. So what happens a lot with psychiatric patients is we have to wait for medical clearance for them to get their psychiatric evaluation. When we do the crisis community evaluation, that they don't have to wait anymore for the psychiatric eval. They still have to wait for a bed if that's what we can do, but we can also disposition for outpatient services, maybe a partial hospitalization program through, you know, Butler, Rhode Island Hospital, Newport Hospital, depending on the area that the patient's in. But emergency rooms are busy. People don't know where to go, what to do, and the only resource that they know is to call 911 and be transported to the hospital. And we're trying to let people know that there are other resources available, at least for the mental health side. And we're not the only agency that does it. We're the only agency that does it in certain areas. But we just want to let them know that there are alternatives, you know, going to BH Link if that's a possibility for the patient, just to avoid the actual stress of going to an emergency room when you're in a psychiatric crisis.
How long have you been doing this work?
I have been doing crisis work for 13 years now, I believe.
When you first started until today, have you seen a significant difference?
My role has significantly changed. So I would say within the different roles that I've held, since I've been in emergency services, I've seen a big difference. Lately, I've seen a lot of kind of either younger patients, I'm talking about, your early 20s, and then we've seen a lot of older patients, 78, 79, maybe losing, their significant other, whether it's COVID or any other sort of health issues. I've seen a bigger increase of those patients than I have, our typical 30 to 50 patients, at least what's being referred to us as part of the SOAR grant.
You bring up a good point, because I don't think a lot of people don't realize when older folks lose their significant other, how rapidly they decrease, both mentally and physically. I saw it myself with my parents. Been married for 63 years. My father passed, and my mother, faster than a toboggan going down a hill.
Broken heart syndrome.
Exactly. Not only that, we're seeing a lot now of overdoses with elderly, because they're going for surgery, they're given medication, which now I think the pendulum's gone way too far to the other side, not giving enough medication for their pain. But the elderly at 4 o'clock, 5 o'clock, what do? They normally have dinner, have a glass of wine, glass of beer, they take their Oxycontin, next thing you know, God forbid something happens, they pass away, there's no autopsy, well, they died of whatever natural causes, and because that number is bigger than what the number is, and that's concerning. It's concerning that we don't have, I'm not saying we don't have enough elderly services, but we have to get these services into these locations, high-rises, senior housing, senior centers. We need more and more and more of that. Is that something that Gateway does?
We can absolutely provide those services, yes. I'm going to challenge you, though, because I'm going to tell you it's not the high-rises, it's not the senior housing, because they have the resources. They have people within those buildings. It's the people who own their own homes, who have lived there for 50 years, who don't know the services that are available to them. We go to an emergency room and we do an assessment, not necessarily Gateway, just in general, and we don't think about asking, the elderly person, well, how many glasses of sherry do you have a night? Because we don't think of it that way.
Exactly.
And they could go into like an acute withdrawal because they don't see anything wrong with it. They've been doing it for 50 years. And we don't think about asking it because it's, a little old lady or a little old man. So we don't think about asking about substances. Right. And I think that's a really big part of some of the issues. The people don't know the resources that are available to them when they're not just kind of thrown at them. You go down in a high rise, you're going to see the posters. You're going to see, like, if you need help, you're going to see the Medicare, all of those things. Right. If you live in your own home, how do you know how to get those resources? Correct.
And we have to figure out a way as a state to get more of the message out that there is help. I mean, obviously this show, having you on, gets the word out. But obviously you have people that sometimes they don't have the capabilities to watch the show, nor do they care to watch the show. But the information is out there, but they just don't grasp it.
Right.
Families are a key component to this. You need to look after your elderly folks. You need to do wellness checks. You need to have conversation. If you don't have conversation, then you're blocking them out. They're blocking you out. And that could be a recipe for disaster.
Right. I agree.
Let's talk a little bit about children.
One spectrum to the other.
Yeah, from older to the little ones. And congratulations, too, on the baby that's coming.
Thank you.
Children in this pandemic. I have a grandson. I see the kids in the neighborhood. I see things that are disturbing to me. They're not in school, they're in school, they're on the computer, they're not on the computer. They don't go out and play after supper. They don't come home when the street lights are on, like I did, because I'm old.
I did it too.
But the problem is that they're not being given the direction, I don't believe, the direction that they need to overcome this pandemic. there's so much misinformation out there. There's so much issues with the booster shot, the kids shot. People don't realize that these kids watch TV. I'll talk a little bit more about that when we come back.
Sounds good.
You're listening to Recovery TV. I'm your host, John Tassoni. We'll be right back after this.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. You know, by quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. Kodak, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
Welcome back to Recovery TV. I'm your host, John Tassoni. And my friend here, Miss Amy McCarthy from Gateway, has been my guest, and she's a clinical coordinator of emergency services. And Amy, thank you for joining us today. It's always a pleasure to see you and have you on the show. I want to go back to children's issues. And I know you're tied with a number of organizations that can help.
Correct.
You know, people are watching, people having problems with their child or children or family members. The floor is yours.
So I would definitely start with KidsLink, 1-855-KidsLink, and they can provide a lot of resources. Also, most schools have school social workers, school psychologists. If you're noticing your child seems off, they're starting to be really moody, just not their usual self, reach out to those people because they're the ones who are there to help. We have a number of different organizations with Gateway, but the real way to get any information is to start with KidsLink and then go from there.
KidsLink just started like a few years ago. Is that accurate, or they've been around for a long time?
They've been around for a long time.
But they just haven't been to the forefront because of once the pandemic happened, they came to the forefront.
I think so. I think once they combined with Bradley, that was a real big push to let people know that one central number to be able to get some sort of kid resources. Because much like the elderly, people don't really know what's always out there for the kids.
Right.
So we want to make sure that they know that.
You know, it's amazing to me how when all this stuff happens with our kids and grandkids, you know, there's over 10,000 youngsters now living with their grandparents because of the substance use, mental health issues. That's a big number for Rhode Island, a real big number. And I'm hoping to have them on my show in the future. But if you have a problem, give us your contact information.
The best way to get a hold of anybody at Gateway is to call our 24-hour emergency services number, which is 401-553-1031. We answer that 24/7. We have clinicians available to talk to you, to kind of figure out what the next steps are. Or you can also go to the Lifespan website and go to the behavioral health section and then navigate to Gateway, and you can see our resources on that website as well.
Great. Well, thank you, Amy, for joining us today. A wealth of information.
Thank you for having me.
You've been listening and watching Recovery TV, and I'm your host, John Tassoni. This is the voice of hope right here to my right. See you next week.
With these,
and this,
with my mouth shut,
and my ears wide open,
it means that from the moment you walk into the room,
you're the most important patient to me.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And will give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
My first experience with addiction was actually with a family member. And I was very young at the time. I didn't really understand everything that was going on, but I knew that it really rocked my family to the core. Now, thank God that family member got the help that they needed. Sometimes you get yourself backed into a corner and feel like you've got to do it alone, but I think it's important for those people that are in that situation right now in their lives to understand they don't have to do it alone. You can make it through this, you can get back on track.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.
Sunday mornings, join host John J Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.